started your timer and here is your question. Right, so if you have read and understood, considering it communication skill station, kindly begin.
Hello, I am Dr. Khawar and a surgical candidate here in this hospital. Are you wife of Mr. X who is admitted in our hospital few days before?
Yes,
tummy
I
swelling?
am. Yes.
Okay. The nursing staff told me that you have some issues regarding his investigation CT scan. Is it right?
Yes, doctor. We have been waiting the whole day. Now it's already 3:30. So we're just wondering if it's going to happen today or not. Because my husband, he's not feeling really well with his tummy swelling, and he looks really sick. And now we are waiting for the CT scan. It has been like a few days ago. We have been told that, oh, tomorrow and then tomorrow. So how long do we have to wait again?
I'm really sorry for this situation. And I know that you also want to meet Dr. Man, who is the consultant, but he is called away due to some emergency. So I was instructed to communicate you regarding this situation. As you know that your husband was admitted in our hospital with the tummy swelling, and we withdraw some fluid, tap some fluid from his tummy that show cancer cells. And Dr. Man advised CT scan, but unfortunately our machine is out of order. So we are waiting to fix this machine. So you have to wait for a few days.
But how long? How long do we have to wait for that?
I cannot say, but it may take a few days. But if it is not corrected or meant by our workshop, then we have some other alternative. We can do ultrasound. It is like a jelly ultrasound for pregnant women, and it can detect how much fluid in the tummy of the patient, and either the liver is involved or not. It can spot some points in the liver. And other option is that we can advise MRI of the abdomen. And the last option that we can transfer this patient to another hospital for the CT scan. But all these things be done by the instruction of the Mr. Man, who is the consultant of this patient.
Could you if this is, why when there's an option to transfer him, why didn't you do it at the first place? You know, it's been like more than 2 weeks now. Couldn't the disease progress to the severe one while we're waiting for it?
I'm really sorry for your apprehensions, but although our hospital is small, and we have limited resources, but we do most of the investigation within 2 weeks framework. And your husband came here for a few days, less than 6 days. And so we are trying to handle this case in our hospital. And I will discuss your problem with the Mr. Mann when I contact him. And if we will not let your husband suffer, And if we feel that he really need urgent CT scan, then we must transfer him to another hospital. But at present, we are planning to wait wait our CT scan machine to be repaired and do the CT scan in our setup.
Doctor, you mentioned that you saw cancer cells in the fluid. So are you sure that it is a cancer?
I'm really not sure and not confirm only the laboratory reports. We are suspecting, but if I say to you that it is cancers, and then I have to give you the answer, what is the origin of this cancer cell, how much it is spread, and what is the stage of the disease, and what is the management, which I cannot give you the answer at this stage. So I am waiting for the CT scan machine to be repaired. After that, I can give you the diagnosis that it is confirmed that it is cancers.
Well, do you think my husband will need a surgery? Because he looks very ill. Will the surgery cure him?
I don't think so, because we do surgery for the patient where we feel that it can cure the disease, or at least it can reduce the symptom and sign of this patient problem, reduce the problem of the patient. And as this is a tummy swelling fluid in the tummy, it means that the problem is in advanced stage. It cannot be cured, and our surgery can just make him uncomfortable and with pain. So there is no need of surgery at this stage.
Well, doctor, could you do something for my husband, because he can't breathe really well?
Yes, I think it is due to tummy fluid that cause pressure on his lungs. So after consultation with the Mr. Mann, we will try to withdraw fluid from his tummy, so the pressure will decrease and he will take a breath properly. Although in addition, we have some medication that can reduce this fluid, but this will be done after the discussion with the Mr. Mann.
Right. Okay, doctor. There's still one question. My brother, his brother is not here right now because he's traveling, but he will be here very soon. But before that, should I tell him in advance before he comes here?
No, it is not advisable that you will mention that his brother has cancer, because we did not do the CT scan, and you must wait for the CT scan machine to tell him actual situation.
All right.
Now let's summarize the thing we have discussed, that your husband came to this hospital few days before with tummy swelling and laboratory investigation, so nasty cell that is called cancer cell. And now we are planning to do the CT scan to mark the actual cause of this origin of this cancer cell and staging of the disease. And a machine is out of order, and I have told you all the alternatives. Do you understand?
Oh, yeah.
And we all are here to help you and to dive your hand at any time. I will leave my phone number to the nurse, and you can contact me at any time. Any question you can ask me. Do you understand?
Yes.
Thank you very much for your cooperation.
Right, thank you.